Fine, welcome. I'm trying to learn medicine. Today, recurrent cold sores. And after we've done it, we're going to do stretching. And if you participate in the stretching, then it's better the honest. Recurrent cold sores. We had in the previous part already the primary cold sores. We could go back to that probably. So here's the other thing. What we're going to do after the stretching, if you participate in the honest, and we're talking about internal anatomy and diseases and illness. And this is no medical advice, we're just reading about it. Recurrent cold sores. The condition usually recurs at the same site, the most common site being the lips and face, but any part of the skin may be affected. The same site we had here, but in adults, especially nurses, dentists and doctors, the skin around the nail is affected. And it occurs at the same site, so it is then probably the infection come in through the nails at that point. Do I guess now? Okay, at the same site does the condition recur. The most common sites being the lips and face, but any part of the skin may be affected. Of the skin. Like the skin. Cold sores. The virus which causes cold sores, known medically as herpes simplex, is one of mankind's commonest infections. There are two types, HSV-1, which carries infections of the mouth, face and eyes, and HSV-2, which causes genital herpes. Over 50% of the adult population have antibodies to HSV-1. The virus lies dormant in the sensory nerve cells for many years. In the sensory nerve cells. So the question, as I said at the beginning, I'm wondering now, why is the skin affected? Why does this thing attack the skin? The virus, why not, whatever, I don't know. Does the word source mean something? But why does it not affect or whatever? Like any other type of illness. Why does it affect the skin? The virus lies dormant in the sensory nerve cells for many years, causing no trouble, but it can be activated at any time. Primary cold sores, symptoms, duration, causes. A virus called herpes virus hominis, an adult primary herpes, may be contracted as a venereal disease and spread by sexual intercourse. So we're talking about also a bit about that, sexual intercourse and genitals. But okay, I have still a question: why affects the skin and not whatever, a headache or something? In general, why do different things affect different things? And why by people different things? People don't have all of the same symptoms. The onset is usually sudden. Tingling, burning, and itching may be felt for a few hours before the typical blisters appear. These break, crust, and become infected by bacteria and cause pain. Why do they become affected by bacteria? Is it inevitable that just there are everywhere bacteria, every kind of bacteria will infect, or is it just that it's most likely to happen? It's not that clean that it will happen. But it would be possible if you take extra care. Why do they become infected with bacteria? It is a virus, they say. So the onset is usually sudden of recurrent cold sores. It is tingling, burning, and itching may be felt for a few hours before the typical blisters appear. These break, crust, and become infected by bacteria and cause pain. Duration. The crusting develops in 3 to 5 days, and healing is usually complete within 14 days. Okay, then for around 3 weeks. 1 week of crusting, 1 week of whatever, this thing, and then 2 weeks of healing. Causes. The same virus that causes the primary infection, previously dormant in the sensory nerve cells of the affected area, it is just in the area. Does it not wander through the body? Why does it not wander? If not, why not? This is a very interesting question. For overall nerve cells and overall illnesses and the infrastructure and coordination system of your body, whatever. We have HSV-1 and HSV-2. Two types. HSV-1 carries infections of the mouth, face, and eyes. HSV-2 causes genital herpes. Does it not matter where the infection of HSV-2 was? The condition usually recurs at the same site. Recurrent cold sores. I think that it's very interesting that it happens at the same site. It's the same place. At the same site. Why does it not wander through the body? It is a virus. It infects the skin in some parts. It comes so easily in. And so many people have it. Why is it? Can people infect themselves at themselves? If they have it at the fingers and now touch their mouth and have it then at the mouth, is that virus both them together? Causes, did we have now? Causes. The same virus that caused the primary infection, previously dormant in the sensory nerve cells of the affected area, becomes active. Reactivation appears to be produced by stimuli, for example, infection, sunburn, cold, menstruation, or an injury. Okay, basically, if there's something being a burden on the human body. An infection, a sunburn, a cold, menstruation, or an injury. Complications. Someone should check completely down what types of injuries cause now recurrent cold sores of HSV. It would be interesting what type of injuries would not do it. Complications. Because I think it's interesting that sunburn and cold do it. What happens when the sunburn is not at the place which is affected by it? So some people get the sunburn, whatever, at the arms or whatever. What if they have herpes at another place? Does it come from an overall exhaustion of the human body? Or is it because at that place where the HSV virus is dormant in the nerve cells, at that place becomes where this, whatever, disrupted by the sun or whatever? And with cold, they mean with cold, the illness not being cold, huh? Extreme cold or sunburn, or they mean cold? Or do they mean extreme cold? I don't know. Maybe more. Complications. These are rare, but can include herptic ulcers of the eye and encephalitis, or the virus may spread to others by direct contact. Sexual intercourse or during childbirth to the baby. Is it only transmittable if it is right now recurrent? Would be interesting to read an article about basically an analysis about or scientific fact-based advices what to do that is not right now recurrent while the childbirth is given. Treatment in the home. Application of alcohol, Vaseline and antibiotic creams may all help to soothe or even reduce the size of a cold sore, but there is no cure. No cure. Only treatment. When to consult a doctor? If the rash is anywhere near the eye. What if people have it at the fingers and then touch their eyes? Is it no way transmittable? Because if not, then if yes, it should be written here very, very big red, and then it should be maybe even closed, not just treated with less pain, but also that it cannot be transmitted directly onward with these people who are infected, wear gloves or something. When to consult the doctor, if a rash is anywhere near the eye, complications must be avoided by seeking early medical advice. So if it's by the eye. They say the complications. These are rare but can include herpes ulcers of the eye and encephalitis. What are ulcers and how can an ulcer happen at or in the eye? Okay, we talked about it. If the recurrence are frequent, as some underlying medical disorder may be responsible. Okay, if people have oftentimes recurrent, then they have maybe an underlying burden lying on their physiological whatever apparatus. What the doctor might do, apart from excluding other illnesses, the doctor may prescribe one of the newer antiviral drugs. Maybe there's new medicine. The book is from the 80s. Maybe there's new. Prevention. None is known. But the virus is found in the blisters, so avoid direct contact with others if blisters are present or broken. Why does it stay the same site? Why does it not spread through the body? Can it anywhere penetrate, or can it only penetrate at one place because we have here sexual transmissible? Can it only at one places or at places which are open penetrate, or just at other places? So none is known, but the virus is found in the blisters, so avoid direct contact with others if blisters are present or broken. Why is it not transmittable if it is dormant? And how would it be able to make a medication which make it dormant, like with HIV? I heard something like that. Outlook. Each attack will clear, but the recurrence is always possible. So basically it's dormant, and from time to time, it comes up. That was a medical part. If you were here for medicine and it was no medical advice, then you can go directly to the next part of medicine. We will do now with stretching. If you participate in stretching, it's better than this. Make sure that we find a path for breathing and lifting the arms up. And breathe out and go to the side. Breathe in a little bit. Out to the other side. In a little. Out and down with your arms. Breathe again in. Out one hand slides down the leg and the other shoulder stays down. Breathe again in. And out we take one arm. Breathe in and open the ribcage. And breathe out a little bit. Breathe again in. Out one hand slides down the leg, the other shoulder stays down. Breathe again in. And out one arm off. Breathe in and open the ribcage. And out and back. Now have feet standing together and breathe in and lift the arms up. Breathe out one arm down and breathe in and reach. And breathe out. Again in, one arm down and out and reach. And one arm up and out and down. Now have the legs standing. Yes. Shoulder wide apart, and we're doing shoulder circles. Back, up, front, and backwards. Front, up, back. And one more time. And now, breathe in and lift the shoulders up. Breathe out and fall down. Breathe in, lift the shoulders up. Out and fall down. Breathe in, lift the arms up. Now pretend to reach high and take an apple hanging high on an apple branch to turn it a bit around and then to pluck it out. And now to the shifter. Next body part, arms up to a T, breathe in. And out, go over to one side. In into the middle. Out over to the other one. In into the middle. Out over to one side. In into the middle. Out over to one side. In into the middle. And out, leaning onto the knees. And breathe again in. And out one shoulder front. In a shoulder back. Out the shoulder in front. In the shoulder back. Out the shoulder in front. In the back. Out the shoulder in front. In the back. And out and we're hanging down, we're doing the Niagara Fall. Just keep normal breathing in. And out. This is a leg stretch, not a back stretch. Breathing in. And out. Again in. And out, go over to one leg. Breathe again in. And out over to the other leg. Breathe again in. Out back into the middle. And below the side of Angelo, bring the feet together and keep one hand down. Just breathe in through the nose. And out from the mouth. Again in. And out comes slowly with a round back up and make it the top of backwards. Shoulder, shoulder. Have a leg standing on white part. Breathe in, go down. And breathe out. Again in. Again in. Out. Again in. Out. Breathe in, cross the legs. And breathe again out. Wait, pause, over the walls, right? That was the stitching. Thank you very much, and until next time.